to welcome you today. My name is Dr. Tim Manis. I'm the Pastoral Care Counselor at the Center for Ministerial Care, as well as the Spirit Care Coordinator. And I am here with a very special guest today, Dr. Heather Quagliana, who is a professor at Lee University. And Dr. Quagliana, I just want to say thank you so much for being here.
Thank you for having me.
You're really in for a treat, because after this interview, you're going to see a lecture. You're going to go into a Lee University classroom, see her lecture, and I think it's going to be very informative for all of our viewers that are watching today. Dr. Quagliana, could you just kind of give us a background, first of all, for people who may not know you, a little bit about yourself and what brought you to Lee?
Yes, I was a student at Lee back many years ago, and I just have a passion for integration of faith and psychology. And so it was always my dream to come back and teach at Lee. And in addition to doing my doctoral degree in clinical psychology, I also did a master's in theology. And so a passion of mine has been to help psychology serve the church better. And I think that is perfectly represented in burnout and how to help pastors, particularly in the Church of God, deal with this issue that is very prevalent these days.
Absolutely. And I like how you talked about the integration of psychology and the church, because oftentimes we think they're separate, and you know, God is a God, he's over psychology as well. And
absolutely.
So in your video on burnout, Dr. Quagliana, is there anything specific that you just kind of want to highlight here in this interview? Just kind of a little bit of a background, or just kind of an outline, if you will, of what the people will be seeing today.
Yes, I talk about burnout and the three dimensions of burnout that we see. One is emotional exhaustion, which is just what we typically think of when we think of burnout. It's feeling depleted and drained. And I've heard a lot of pastors and ministers say they just feel depleted from ministry work. And I think we almost think of it as a badge of honor. If we're doing God's work, then we feel burnt out. But I'd like to challenge that idea, and you'll see me in the lecture challenge that. There's also other elements of burnout: depersonalization, feeling like you're just going through the motions in life, as well as decreased personal accomplishment. And all of those combined lead to this sense of burnout. And what we've found in research is that burnout is also causing pastors to leave the ministry. So if we can talk about it and have a real conversation and think of ways to prevent it, then I think we're going to have more effective ministry in the end.
Absolutely. And when you talk about burnout, how much of that implies ministerial self-care?
It's huge. I think there's a direct link between those two. I think that ministers are so busy taking care of other people that they forget the important ways to take care of themselves. And what we've found particularly helps burnout is relationships. Good marital relationships, good family relationships, good relationships with congregants. But that can also be really difficult in the midst of a high impact ministry and the different tasks that pastors are called to do.
Wow. And with the work hours that our pastors go through, a lot of our pastors and ministers that are watching today are even bivocational. And then they've got a family. And so with all of that just compounding and all that stress just adding up, this is a very much needed lecture that you're going to be listening to here today. Do you have any resources that maybe after our ministers watch this, that they might want to enhance their library a little bit? Any suggestions that they go to Amazon or someplace and get something that's going to help them in this area?
Absolutely. In the lecture, you'll hear me talk about ways to potentially prevent burnout and intervene when it's occurring. And one of those is managing boundaries. That can be very difficult in ministry. I recommend the books by Cloud and Townsend, the Boundaries series. There's general boundaries, there's boundaries in marriage, there's even boundaries with children books. And so that whole series can be really helpful for conceptualizing how to set those effectively even in ministry. I would also recommend when we think about burnout, one of my suggestions to prevent it is to develop a theology of suffering. Psychology has a lot to say about suffering, but theology has just as much, if not more, to say about suffering. And I think pastors often burn out because they're faced with these difficult situations where they haven't been trained to deal with trauma or some of these issues. And so I would recommend some books around developing theology around suffering. Two of my favorites are The Wounded Healer by Henry Nouwen. And then also Nicholas Walter Storff has a book called Lament for a Son. And it's just a really nice way to think through theology of suffering, as that may even relate to burnout.
I actually have both of those books, and they're excellent resources. So you'll definitely want to check those out when you give them the chance. Well, Dr. Quagliana, I just want to say thank you so much for opening your classroom, allowing us to kind of come in and really get a taste of what a Lee University classroom is first and foremost, but something also that's going to help help our ministers, quite frankly. This is a topic I think that is prevalent for all of us. And before I let you go, do you have any words of encouragement, words of advice for maybe there's someone watching today and they're feeling burned out and they're ready to give up?
Yeah.
And they need that extra something to help them kind of make it through another day.
Yeah, my recommendation is to really think through what is practical coping. In ministers that have been surveyed in previous studies, we find that ministers tend to cope through, the ones who are doing best tend to have hobbies, tend to do things outside the church. And I think I want to just give the pastors permission to do some things for themselves, because in the end, it's equipping them better to serve their congregations.
Wow.
And we're also currently doing a study looking at Church of God ministers. So some of the ministers listening may have received that survey, and we're excited to design our own manual tailored to the needs of Church of God pastors. So we hope that that's forthcoming very soon.
Wow. I look forward to the results of that study too. Thank you so much, Dr. Quagliana. You're going to want to watch this lecture on ministerial burnout. I pray and hope and believe this is going to be a great aid for you now and into the future as you continue to do the work that God has called you to do. Thank you, and God bless.
All right, so we're going to talk today. I think that one of the primary ways that psychology can serve the church, and you know that I'm very passionate about this area, I think psychology can serve the church by many facets, right? But one of those, I think, is how do we help pastors in ministry? How do we help promote leadership within the church to do best ministry to congregants, okay? And this is an area that's been studied quite a bit in the field of integration. Remember Mark McMinn and some of his research work? Mark McMinn started off studying pastors and studying how can we bridge the gap between psychology and the church, and what does that particularly look like? And so what I've done and what I have launched recently is looking more closely at how we can support ministers, but also I'm gathering some data of my own. What are some of the coping strategies? What are levels of burnout with ministers? Because that's one of the big reasons they leave ministry, is that sense of, I can't do this anymore. I am just burnt out and tired of this. I can't go on. And so how can we help even address that, but better, how can we help prevent some of these issues? Because some of them are preventable, and ministers can do better ministry using some of these simple psychological principles, all right? So first, I want to hear from y'all for a minute. How would you define burnout? Let's see if we're in line with the psychological research. So what is burnout? Okay, not wanting to do your job. Yeah, feeling burnt out, like I can't, or I don't even want to do what I'm supposed to do. Okay.
You stop feeling empathy for your patients.
Okay, that's good. You stop feeling empathy for your patients, right? Many of you want to be therapists or counselors, and what happens if you stop feeling that empathy? Like, sorry for you, tough day, but you're experiencing that burnout. Yeah. Yeah, absolutely. So fatigued. How many of you are feeling fatigued emotionally and mentally? Yeah, absolutely. When we look at research, that's the component of burnout that we call emotional exhaustion, right? I can't do it anymore. I'm so fatigued. My brain just wants to bust wide open, okay? Anybody else? How would you define burnout? Okay, apathy. Yeah, kind of, I don't care anymore. I don't have the capacity to care anymore. Okay, yeah. Anything else to think through that definition? Burnout. What a lot of you have mentioned, okay, would fall into that burnout dimension that I said of emotional exhaustion, okay? That probably what most of you, if I gave you the burnout inventory, you would probably elevate that score clinically right now, okay, just because of where you are, what you're doing. Now, what's interesting is there's two other domains of burnout that we don't often think about, okay? Emotional exhaustion, we pretty much think about that. But there's one called depersonalization. And that is where you feel like you're on the outside looking in at your life. Like, I'm going through the motions, but I am totally disconnected from this experience, okay? that also falls into that burnout category. But what other concept does that feel closely related to? You feel like you're just going through the motions, you kind of feel checked out. Any other psychological issue that sounds like? Sound like depression? A little bit? Yeah. And so oftentimes we see burnout and depression having some correlation, okay, and some link there. And I think that's important to take note of, right? Because a lot of people would say, oh, I'm just burnt out, no big deal. Well, if not properly addressed, it can lead into some of these deeper feelings of depression, okay? So we have emotional exhaustion, we have this depersonalization, but something else we see with burnout that we often forget about is what's called decreased personal accomplishment. So when people are truly burnt out, okay, there is this idea of, I'm not accomplishing what I want to accomplish. Anybody there in this room? Okay, like I just can't even set out to accomplish these things. And it's interesting because sometimes people who are burnt out, pastors who are burnt out, okay, they may not actually be accomplishing what they want to accomplish, okay? But also, it could be a perception issue, couldn't it? They may still be accomplishing things, but their appraisal might be, I'm not doing so well. And so that matters. And again, we see that link to depression, don't we? That appraisal of your situation. What does that look like? So as we move forward, I'll hit this again to remind us, but as we move forward, 3 dimensions to burnout. Emotional exhaustion, that's what we described, right, to think of. I can't do it anymore, I'm tired, I'm fizzled out, my brain doesn't work, I just want to go sleep, okay? The second dimension, depersonalization. I am on the outside looking in, just going through the motions, okay? But that can become dangerous, can't it? If we lose empathy for clients, if we lose empathy for people we're trying to help, okay? And then the third piece is going to be that decreased personal accomplishment, okay? You're not achieving like you want to, or you perceive you're not achieving like you want to, okay? Make sense? That's how we operationalize burnout, those different things, okay? So when we start applying this to how psychology can serve the church, and we start looking at self-care, burnout, what is this climate like with ministers and pastors, I think it's very interesting discussion. I think particularly with ministers that I've worked with and pastors I've worked with, it's almost like a badge of honor to be burnt out, right? I am doing so much. I am doing God's work. It's a good gauge of if I'm accomplishing what God wants me to accomplish, then I'm probably going to be exhausted and burnt out. I think we need to reframe the discussion because I don't think that's an accurate gauge of fulfilling God's calling. Because if burnout really is emotional exhaustion, depersonalization, decreased personal accomplishment, how do you sustain yourself in ministry if that's what you're dealing with on a daily basis, right? Is that going to be somebody who can long-term do ministry well? Someone who's having all of those issues? Dylan says no. Okay. No, it's hard to maintain that, isn't it? Okay. And so I think we have to think what makes effective ministry, okay? And part of that, I think, is the prevention of burnout. When we look to the research, one of the number one reasons that pastors say, I'm done, I am leaving the ministry, it's this idea of burnout, or sometimes it's called compassion fatigue, okay, in the literature. And so if that's the number one reason why pastors are leaving, is this idea of burnout, and burnout is a very psychological construct in nature, don't we have a responsibility to serve the church and to say, what can we do to intervene, but what can we also do to prevent some of these issues, okay? And oftentimes, psychology does not think preventatively, and neither does the church. We're often responding to crisis situations. And so if we can prevent some of this, I think that is the key where we can have our greatest impact, okay? Now, this idea of self-care, you hear this a lot. Take care of yourself, okay? It's become a buzzword, all right, in psychology. But I think there is genuine truth to this, and there are ways that we can take care of ourselves. And it's not as simple as, well, make sure you relax every day, okay? It's not as simple as, well, when you're overwhelmed, go take a bath and feel better, okay? Eat your favorite snack. Self-care is honestly a lifestyle choice. And self-care is something that is important to make it, I would argue, even a spiritual discipline. In a moment, I'm going to share some of McMinn's research that he's done. And what he found, pastors who are doing well and thriving in the midst of high stress, guess what they're doing? They are doing things, hobbies, time with family, but they're also using prayer, reading scripture. They really have a lot of spiritual disciplines that coincide with self-care. And so I think it's important to make a lifestyle around those things and to figure out how you can prevent, again, burnout. All right? I think that as I talk about reconceptualizing burnout, self-care, some of these different things, I think that the value of properly taking care of yourself, it's been well documented, but it's hard to find that space in busy ministerial careers, okay? But I think it needs to be reconceptualized. There's certain articles when we look at burnout research that say we need to reconceptualize self-care really as leadership training. To be an effective leader is to also learn to take care of yourself and implement some of those spiritual disciplines as you do it. I would argue the same is true for y'all as future psychologists and counselors. This idea of burnout on top of what we call vicarious trauma, if you're sitting with people in suffering all day, pastors do this, therapists do this, other disciplines do this, it is so important to learn that value of self-care because you're going to feel burnt out. You're going to take on other people's trauma and deal with a lot of these things. And so if we conceptualize this in ministry as leadership training, an essential component to being a good leader, isn't that a better frame on it, right? I'm not preventing burnout because I'm selfish or because I need to achieve all this psychological development, but I'm preventing burnout because it makes me more effective to my congregants, right? It makes me more effective to live out what God's called me to do in the church, all right? Another piece, when we look back to some of the literature, I've already mentioned this, but I wanted to mention the Maslach burnout inventory. Christina Maslach is a researcher who has been working for decades on this construct of burnout and how do we best measure it, okay? There is the Maslach burnout inventory, and there's a whole version of this, okay, that is geared towards those in the helping professions, the service professions. Pastors fall under that category as they are serving others in ministry. And so when we gauge pastors' burnout, we use this instrument, okay? And so it has questions, for example, I feel emotionally drained from my work. Where do you think that would load on the burnout dimension? I feel drained. What'd you say? Emotional exhaustion. I feel drained from my work. I feel like I can't go back another day and do this job, right? That's the most common dimension that we see. But then we also see, as I mentioned before, the depersonalization. I feel disconnected. I feel like I'm going through the motions. I have no feelings as I'm, performing these duties of ministry, okay? And then the decreased personal accomplishment. But this instrument, it's a 22-item instrument that has these 3 subscales that gives us so much information and knowledge about this. So when we look to the literature and we look at pastors and how we've studied their burnout, we've used this, okay? But we've also used this combined with other things like religious coping, how do you use your spiritual disciplines to combat some of this? How do you also use time with family, relationships, etc., to combat some of this burnout, etc. Now, I wanted to give you one more term to think about this, okay? And it's the idea of compassion fatigue. Some researchers distinguish between these 2 terms, and then others don't. When we think of compassion fatigue, what do you think of when I say compassion fatigue versus burnout? What does that kind of evoke? What would you say if I make you define that? Yeah, Trey.
Like, burnout is almost more internal, like this right now.
Yeah, I think there's some distinction. When I think of compassion fatigue, it's almost like I am so emptied out, I can't even be there to support you anymore, right? Versus that burnout may be more of an internal process that's going on. Yeah, some do distinguish between that. And again, when we look back to the literature on pastors, we see that this idea of compassion fatigue and or burnout is why pastors are leaving the ministry. But we are not putting the emphasis on self-care to prevent it that we should. And I think that, again, pastors feel like it's selfish when I have so many people hurting in my church, right, for me to take care of myself. but it's necessary to sustain, right, ministry. Because what we see is pastors starting out, I think, with this kind of ideological, I can do this and I can serve with no care for myself, but then they're burning out early in their careers and leaving ministry altogether. I think we can prevent this. We've just got to just shift the emphasis just a little bit, okay? When we think through this idea of what pastors do, though, I mean, think of the many roles they take on. They're often first responders to crisis situations, right? Those of you in this room who go on to be counselors, therapists, even researchers, you're going to get training in how to deal with trauma, right? You are going to get training in what kind of toll it takes on you to sit with other people in their trauma. Most pastors don't get that training. They are sitting there with people who may be disclosing sexual abuse, who may be disclosing, all types of traumatic events, but they don't have that buffer of, oh, okay, it's normal for me to experience these things, or to have this vicarious experience of trauma, to feel like I'm hearing this, but I feel like I'm right here in the trenches with you. I think of an example when I went down, I've mentioned before, the time I spent in Ecuador doing some of the earthquake response there. The first responders who everyone went to in the community that we worked in, it was the pastor. He was the one who was pulling bodies out of the rubble. He was the one who had the moms coming to him saying, I lost my children. He and his wife were the ones saying, okay, we're going to help you. Here's basic needs that we need to meet. And so while our work focused on helping relieve children, parents, from some of the trauma, part of our work was focused on the pastor and his wife saying, what you've been exposed to by helping others and taking on their pain, if we're not careful, that is going to take a toll on you and you are going to completely burn out after an incident like this, okay? And so pastors are stepping into these situations that are often overwhelming for anyone, even someone who has professional training in this. So how do we again promote the value of self-care and even some psychoeducation about what it means to sit with people in suffering, right? And I would also too I've challenged y'all, but I also challenge pastors too to think through, what is your applied theology of suffering, right? I mean, we can read in Scripture, there are excellent examples of Job, right? David in the Lament Psalms. How do we use what Scripture tells us to inform what we're doing in the here and now and what are applied? I don't say just a theology, I say an applied theology. When we're in these circumstances, what is the value of self-care to sustain ourselves in this work? And I think that's an important question. All right. I've mentioned already, compassion fatigue and or burnout, depending how we define it, has been found to be one of the major risk factors for leaving the church altogether. And so how can we get in there early, educate, intervene where necessary, where we're seeing some of these high-risk situations, if you will. One of the major issues that the literature highlights, and I'm also finding this in my own research that I'm doing right now with pastors, loneliness and isolation are two of the biggest risk factors for burnout, all right? But this gets tricky, doesn't it? Oftentimes, pastors are working in isolation for many reasons, right? So pastors are working in isolation sometimes because of their setting. They may be in a rural setting and they are doing God's work in an underserved area, so they find themselves very disconnected. Okay? Another thing is it can be difficult when you are in leadership, right? When you're in leadership and you are trying to be professional as a pastor, okay? But also, it can make it where it's kind of lonely at the top, if you will, right? That idea of, I'm here to serve my congregants, they're not here to take care of me, right? So it can be very isolating when you are in that leadership and ministry role. Do you talk to other pastors? Do you talk to members of your congregation? Because that can be really risky, particularly in a small church, can't it? What if you disclose something to a member in the church, but then they tell so-and-so who tells so-and-so, and it was never intended as malicious, but there's no privacy sometimes, right? And so how do you deal with that loneliness and isolation? I've seen this again coming up in my study. As I've surveyed pastors, they're saying, we're lonely, we don't have connection to other pastors. So I think that's one of the tangible ways we can intervene, isn't it? How do you connect other pastors to get that support from one another? Because it can be difficult to manage that in the church setting. Are you friends with someone in your church, or do you hold that professional boundary? How does that all work? It can be very, very complicated. And pastors are saying this is really proving to be an isolating experience. This idea of transparency and vulnerability. To prevent burnout, it is important to have people you can be transparent and vulnerable with, right? That's very important. But for pastors, that is complicated by the fact of, I am in the role as a pastor. Can I be transparent? Can I be vulnerable? Well, let's be honest. When pastors make mistakes, right? When pastors find themselves in a difficult situation, I think unfortunately people are quick to judge, right? Because you're in this leadership position. And so how do you figure out ways to be transparent and vulnerable and trust others with things that you do need to discuss? It's unrealistic to think that pastors don't struggle. Pastors are human too, but I think we have elevated them to a status of, if you make mistakes, you're going to be the most harshly judged for that. And there is, in leadership, right? It is important that there are certain privileges and ways that you need to act that come with leadership, but I think we're doing these things at the expense of nurturing pastors in this burnout. We're losing amazing pastors because we're not appropriately addressing the core issues of loneliness, isolation, which can often lead to depression. Does that make sense? Because I think that this is one of the key pieces to address. And when I go over the way that pastors typically cope, you'll see that it's not really helping out the isolation issue. And so I think we need to rethink interventions in that way. All right. So here's a little bit from McMinn's research. Okay. So Mark McMinn, who's one of the big names in integration of faith and psychology, his big passion is, how can psychology serve the church? How can psychologists and pastors work together? Okay. And so he's given us good suggestions on how to collaborate and do that well. But he's also done several studies on what the pastors who are thriving, the pastors who are doing well and not burning out despite all of the ministry stress, what are they doing? Because we want to learn from their example, right? So we can replicate this and disseminate this research to other pastors, okay? So he asked a question, and then he coded everything based on the qualitative data. He said, to what do you attribute your spiritual and emotional health? Because the two are interconnected, okay? And so what he found is he found two different levels of coping. McMinn found that there is what we would call intrapersonal coping and what we would call interpersonal coping, okay? Now, interpersonal coping, let's talk about that one for a minute, okay? That one's what we typically think of, relationship with spouse, friends. It's those relationships that we have, right? Okay. But if it's hard as a pastor to be able to do authentic relationships, do you imagine that piece of coping might be difficult too? Absolutely. And so while doing that type of coping helps prevent burnout, we often see obstacles to implementing that type of coping, okay? Now, intrapersonal is going to be kind of what's inside of you. So feeling that connection to God, scripture reading, prayer, experiencing God's grace, those are some good examples that we see, okay? So to what do you attribute your spiritual and emotional health? Pastors who are doing well, who are thriving, not burning out, okay, in the midst of very stressful situations, they say, here's what I'm doing. Intrapersonal, I'll say it again, feeling connected to God, reading scripture, praying, experiencing God's grace were some of the top themes. Pastors who are doing well, not burning out, okay, their interpersonal coping, relationship with spouse, stable upbringing, mentors, and accountability. So let's stop for a minute and think, as future psychologists, where is our greatest opportunity for prevention of burnout? If isolation is one of the biggest predictors of burnout, okay, and we hear exemplar pastors saying, when I have a good relationship with my spouse, a stable upbringing, mentors, and accountability, then I tend to do well in the midst of stress and not burn out. What would be our psychological recommendations? Talk for a minute. Community, yeah. So pretend for a moment you're going into a church and you're developing community programming. What would you do? What would we target to help prevention of burnout for pastors? Relationships. Okay. How so? What would we target?
Help people trusting.
But healthy relationships. But what if we did a marriage seminar and focused on healthy marriages, right? Pastors who are thriving and doing well report having that connection to their spouse. They don't report a perfect marriage, but they report having a good marriage where they feel supported. When they're about done with that marriage, right? That's typically when we get them in. But so many of you want to do this marriage and family work. Get in there and do preventative work. Build healthy marriages from the beginning, right? And particularly with pastors, what do you do with the unique struggles that pastors present, right? In marriages, and how do we nurture that? What's another one? Taking what research is telling us, what would be another way to prevent or address burnout? What about mentors? What about figuring out ways to connect pastors to other pastors? Do you think that vulnerability and that ability to share of yourself would be different with congregants versus other pastors? It should be, shouldn't it? I mean, I think this idea of how do you connect a pastor in a rural area to other pastors, right? With technology these days, you could schedule a little Skype support group every week, right? I think that there are little things like that that will make a huge impact and big difference. How do you connect other pastors to other pastors for support? How do you enrich marriages? How do you figure out ways for pastors to have a safe space to share their concerns and struggles, right? Because I think that once we create some of this, pastors will have that opportunity to share with one another, to enrich marriages, thus hitting that loneliness and isolation piece, which I think is a huge driving point of the burnout, right? I think oftentimes we say cope better, cope better, cope better, and we focus on that intra-personal, which is great. We need that too, but we do it at the expense of the interpersonal. And if loneliness and isolation is one of the biggest predictors, we have to do measures that address that as well. And we can get creative with it, okay, and how we do that. Now, the pastors were also asked, what is the most important thing you do to prevent high levels of exhaustion and stress in your work as a pastor? So you see the themes again, intra versus interpersonal, okay? Now, intrapersonal matters, but I would argue again the interpersonal is the most important because we want to reduce isolation, okay? So with intrapersonal, what you see is hobbies, time away, prayers, exercise, rest, relaxation, and then also setting good boundaries. Do you think good boundaries are hard to set when you're a pastor? Yeah? Absolutely. I know there's some pastors' kids in here too, and you'd probably say, oh yes. It is so hard because when someone's in need, people's needs don't just occur at church times, right? Okay. It's all that space in between. And so establishing good and healthy boundaries is important. Okay. There's a great book. You've probably all heard of it, but Cloud and Townsend, the book Boundaries. Have any of you heard of that? It's a great book for boundaries and establishing boundaries. They have establishing boundaries just kind of in general, establishing boundaries with kids, establishing boundaries within marriage, and I think this is very applicable to ministry work and those different things. Now, what is the most important thing you do to prevent high levels of exhaustion and stress in your work? What are the interpersonal pieces? We see family time come up, okay? So those of you who want to be marriage and family therapists, is this not such an in with the church? How do we nurture families? Again, we see spouse, okay? How do we nurture marriages? Friends, accountability with other pastors. And so those who are doing well in the midst of stress are meeting up with other pastors to meet some of those needs, right? They're not isolated, but they have people in a similar situation, similar struggles, where the risk of vulnerability is worth taking because you're in a similar situation. So my question to y'all, okay, because you're going to be doing this work, how do we create effective support for pastors? Now, in a big city, it'd be easy to say, okay, once a week we grab lunch, or once every other week we do this, right? But think of those rural, more isolated areas, right? What do we do? How do we connect via Skype? How do we connect, in ways to talk about our struggles and be genuine about that? Because research tells us, experience tells us, that's what's working to prevent burnout, but also hitting on that issue of isolation and connectedness to others. All right. A few more things. When I think through burnout prevention strategies, okay, this is me kind of tying together the current literature. Y'all get that idea of the 3 levels of burnout, right? Emotional exhaustion, depersonalization, decreased personal accomplishment, okay? Loneliness is a huge predictor of burnout in pastors particularly. But then we also see the intra versus interpersonal coping themes, right? We want to bolster all of that, but we really want to focus on that interpersonal. Now, when I think through a few more strategies, I just want to go through these and then open it up to any questions or thoughts you have. But I think something I would recommend is I think that psychoeducation for pastors is important. This idea of educating pastors about you are sitting in pain and suffering. They know this part, okay? But that idea of vicarious trauma and the toll it takes on you. I am a psychologist who is trained right in trauma work. And I am still taken off guard and taken by surprise sometimes by the level of vicarious trauma I experience. But I've gone to school forever, right, to learn how to do and deal with this, but I still find myself muddled down. Imagine if you haven't been prepared for that idea of taking on other people's trauma. It can be shocking and it can feel like it's destroying you in the process, okay? So just education around vicarious trauma, education around sitting in other people's pain takes a toll on you. And how do you get relief from that, right? Where do you set boundaries? Where are the limitations in terms of when you need to refer to professionals, etc., and help bear that burden in Christ? Another prevention strategy based on what we've talked about, we need to bolster coping resources. Particularly interpersonal, okay? Whether that's nurturing relationships, a marriage seminar, whether that's pastors getting couples counseling, family therapy, taking more time with your family to do fun things. We need to help pastors figure out plans to bolster that particular type of coping, because that's not only going to help, okay, build relationships and enhance that, but it's going to hit on that loneliness piece that seems to drive this. Okay. Tend to your marriage is very, very important. All right. The research that I'm doing right now too on surveying pastors, we're finding the same thing. I mean, those who report, positive interactions, positive support from spouses, that does tend to buffer, okay, against burnout. Because you've got a partner in this, right? You've got someone who's on your side who can help you in this stressful process. Learn the signs of your burnout and compassion fatigue. I think we often, myself included, it's almost like burnout sneaks up on us, right? You feel like I'm doing fine, I can't do this anymore, and you crash. There are actually signs that can help us attune to this, right? So helping pastors understand this didn't just happen overnight, okay? You didn't just wake up one day and you were burnt out and yesterday you weren't. But what are the signs? For some, it is they tend to withdraw more, right? As things are getting more stressful, they withdraw. Well, that could be really damaging with that isolation piece driving this. It could be you start snapping at people. It could be you stop having empathy, right? It could be you do certain things. But I think some of the most effective work that pastors can do is learning those signs of, I'm in the early stages of this, How do I start to enhance this coping, enhance some of the spiritual disciplines to fight or to reduce the impact that the burnout's having? Another one that's important is to tend to what's called spiritual dryness or depletion. I didn't mention this before, but one of the biggest reasons, in addition to isolation and loneliness, that pastors say they're burning out is this idea of feeling spiritually depleted. Now, I think if we do some psychoeducation on vicarious trauma, that can help with some of that, right? Because you feel depleted when you're taking on other people's pain, okay? But I think that spiritual dryness and some of those things could also be addressed in group pastoral support. I think this idea of even just sharing what are some of the spiritually renewing things you do, right? And one pastor may say, when I am in these times, I go back and read a lament psalm and realize it's okay to be in this place where I feel depleted. Or others may say, I find it really helpful to focus on gratitude, when I'm in the midst of a difficult situation. I don't think we need a big fancy formal technique for this. I think we just need to have awareness that depletion happens, that it's normal, and how do we nurture and water, our faith in those difficult times. Okay. I've already mentioned this, but managing vicarious trauma is huge. Another piece that's not often talked about, I think, in the pastoral world is managing your own trauma. Trauma, I've shared a lot of this with you, but when we think of different types of trauma, pastors have trauma histories too, and it's not just vicarious trauma histories. When we think of sexual abuse statistics, right? 1 in 10 children before the age of 18 will be sexually abused. That includes pastors. That includes this room. No one's exempt from this, okay? When we think about physical abuse, we think about neglect. We have similar statistics. When we think about exposure to violence, when we think about witnessing difficult things. I think pastors need to understand that when they are helping someone who's been through a similar situation, it's normal to get triggered, isn't it? And just the peace that can come from realizing that's normal to get triggered and how to manage some of those triggers can really help prevent some of that burnout, right? Knowing that happens, it's part of the work, but how do we move forward? And oftentimes it's helpful for pastors to get their own therapy with a Christian therapist, right? To be able to talk through some of their struggles as a pastor, but how do I set boundaries? How do I manage my own trauma when I'm sitting with other people who have similar issues? I've mentioned this already, but develop a theology of suffering. I've told y'all to do this, right? I said, you can't be a counselor or psychologist if you don't know what you think about suffering. But I also challenge pastors to do this as well. Think through a applied theology of suffering. When you are in the moment, when you are studying scripture, when you're sitting with someone, where are those points of tension? Where are those points of connection? And how do you apply that to your sense of calling and what you're doing? Address loneliness? Absolutely. If that's a big driving piece, the number one predictor, then we've got to get our coping aligned with addressing that. Enhance social support. Social support, right, is our fancy way for saying get more connections in places that are safe for you. And then finally, utilize spiritual interventions. How do we incorporate, what we know of the value psychologically and spiritually of the utilization of spiritual interventions to help prevent burnout? So thinking through God images, right? Oftentimes our God image doesn't match up with what we've been taught about God, right? Our emotional experience of God can be mismatched from what we know of God, and pastors aren't exempt from saying, my experience is, God, I feel alone in this situation. But most likely they've been taught and are teaching the congregants that God is faithful. So how do you discuss these difficult things? God is faithful, but it's okay to feel that you've been abandoned too. And working through those different emotions, working through those things that can be really helpful to make you more effective for ministry and those different things. Even thinking through, different scriptures and what they teach us about connection to God, right? Thinking through forgiveness. All of these are examples of spiritual interventions that we can use to help prevent burnout in pastors as well. Any thoughts or questions? The book Boundaries by Cloud and Townsend is very good to address some of these. When we think through a theology of suffering, what I recommend is the book Lament for a Son by Nicholas Walterstorff. And then A Grace Disguised is another good book for kind of working through suffering and some of those things that come from ministry and suffering. Thoughts or questions? Yeah, Jonas.
You mentioned earlier that burnout has become like a buzzword in ministry.
Yeah.
So how do we go about, like, I know education probably plays a big part in that, but how do we start reversing that idea?
Yeah. If you didn't hear, Jonas said, how do we, with burnout being a buzzword, how do we basically show that this is a legitimate concern and make it something that people want to listen to, not just self-care and burnout? I think, yes, part of it is what you said is education, right? I also think a huge piece, and I think McMinn would say the same thing, okay, is that it takes us in this room, for example, just having intentional relationships with ministers and pastors, right? He says that one of the biggest things is psychologists need to build relationships with pastors in informal and formal ways. And so it starts with that relationship, because then it's, okay, I have a name to put with psychology, right? It's not just psychology is this thing that can be good if it's Christian and done right, but it's secular if done wrong, right? I think it puts a name with, this is even if it's your own church, getting to know your pastor and being able to just say, like, how are you doing? This burnout thing is a buzzword, but it's a legit thing that we've studied, and how can I help support you? And so I think even what's being done here in this room with videoing a lecture like this for Church of God ministers, it educates that, it's a buzzword, but if you really dive in, there's a lot of valuable stuff that you can do more effective ministry if you buy into this. Absolutely. And what we're hoping to do with the research that I'm doing right now with pastors is we hope, based on our results, and we're finding things very consistent with what McMinn has found already, but we're looking particularly at personality and burnout and religious coping. What we hope is, once we've done all of the research and collected the data, we hope to write a manual for Church of God pastors that we can deliver little seminars. Pastors of the church can deliver it, to their staff. We hope to create something very usable to say, here's what we know, here's what you've said will help you. Let's just figure out how to implement this and just give some tangible resources. Pastors are busy. They need something that's accessible and tangible to help with these issues. Yeah. Other thoughts or questions? I hope this burns in some of you as a passion to go do this work, because particularly as marriage and family therapists, this is a great in to doing ministry plus psychology. It's a beautiful opportunity for integration of your faith and to serve the church. Anything else? Yeah.
Can you talk about how the spouse relationship is really important?
Yes.
Do you think there's any good resources that are specifically for spouses of pastors?
Absolutely. I think that the pastors and the marriage, needs to be supported, but then spouses of absolutely. One of McMinn's studies focused particularly on this, where he said, I want to listen to the spouses of pastors, because I think the needs are similar in some ways, but unique in others, right? And when you are in a supporting role, what does that look like? Yeah, absolutely. There's need for that. There's need for work together, but then work separately as well.